History of chronic fatigue can be given in chronic fatigue syndrome, fibromyalgia, and even polymyalgia rheumatica. If all have history of fatigue and malaise, there is history of non-refreshing sleep more in a case of non-chronic fatigue syndrome than in fibromyalgia, and there is no history of non-refreshing sleep in PMR. Trigger points is seen in fibromyalgia but not seen in PMR and CFS. Blood investigations, you will see normal blood investigations in both the fibromyalgia and the CFS, but there is increase in ESR in polymyalgia rheumatica. Treatment is reassurance in chronic fatigue syndrome. In fibromyalgia, you have to give pain reliefs. In PMR, you will have to give steroids. And then myopathy syndromes, again you may have PMR or inflammatory myopathy, hypothyroidism myopathy, steroid induced or statin induced myopathy. Typical history in polymyalgia rheumatica, all cases will have pain, muscle pain, will have tenderness also, and shoulder and pelvic girdle pain is classical. Restriction of movement is seen. They have a good response to steroid. In inflammatory myopathy, you will have a typical history of muscle pain with proximal muscles involved more, and there is history of skin rash and inflammatory arthritis. Hypothyroidism, there will be features of hypothyroidism, that is fatigue, diarrhea, weight gain, menstrual abnormalities. Along with that, they will have decreased deep tendon reflex. Steroid induced and statin induced are side effects of drugs. There will be history of steroid abuse in steroid induced myopathy. Along with that, there is specifically no pain is seen. Progressive proximal muscles are involved. Initially weakness, and it can progress to atrophy also. In statin induced myopathy, there is history of statin. Along with that, you will have they will have a prominent pain which is not seen in steroids, and they will also have rhabdomyolysis. Blood test ESR is increased in cases of PMR. In IM, hypothyroidism it will be normal, and drug induced also it will be normal, whereas CK will be normal in PMR, increased in inflammatory cases, increased in hypothyroid cases, normal in steroid cases, and increased in statin induced myopathy. Steroid induced will have both normal ESR and CK with no pain also.